A good day to one and all. I would like to thank the organizers for giving me this opportunity to be in front of you to do the presentation today. All of us are people who love nature. All of us are people who are attracted to anything that is having a beauty or an uniqueness towards it. But not all of us have the eye to see it. Not all of us can see things in a unique, different way all the time. But there are people who can actually capture whatever is their vision of a unique object or a scenery, and they can actually present it to you so you can see what they are visualizing. And that is a mark of a true artist. When it comes to smile, all of us know that every person has a unique smile which is very special to their face. And that's why we say a smile is the prettiest thing that you can wear. And our job as dentists is to make sure that a patient who has come to us, we give them the confidence to not smile like this. We give them the confidence to smile with showing all of their dentition out. You give them the confidence to talk to anyone, to be presentable. And that basically is the soul of aesthetics. And I'm here to talk to you on certain clinical strategies for aesthetic restorations. The first step is listening to your patient. You have to make sure that even if a patient has a tendency to go on talking, you have to sit back and listen to what the patient has to say. You have to understand what are the patient's expectations out of you and what they want to see at the end of the treatment. Understand this that certain patients have unrealistic expectations. It's very important that you see this or you foresee this before you start your treatment plan, because you have to bring the patient down to realistic expectations. You have to make the patient sit down and tell them your expectations are unachievable, and this is the best that I can do, and this is going to be perfect for you. But again, all of us know the ads are always made to enhance our taste buds, or our is got set to please us so that we buy the product. But when the actual product is delivered, it is not up to our expectations. Whereas on a dental setup, it is important that you do not oversell yourself, because once you start overselling yourself, the patient's expectations go really high. So it's always better if you can undersell yourself. You tell the patient that this might be doable. I will try doing my best. May not be as much as you expect, but then yes, I will give it my best. So the patient's expectations are at a neutral level. They are not going to have very high expectations. But at the end, when you deliver and you have done your best job, the patient is going to be like in awe of your work. They're going to literally sit on the chair and start crying. And that's when you feel the kick of being an aesthetic dentist. And that is what I'm going to talk about today. Our weakness as dentists is that we are focused on teeth. Our when we are having a conversation with somebody, all we see is their teeth. Okay, they're having a crooked smile, they're having a diastema, they're having a class 3. Our full focus and attention is only on teeth. And to an extent where if a patient is walking down in a hall and they say they have a tooth pain, the first thing that you're going to say is that, okay, can you open your mouth? Can I just see what's wrong with you? Right? So that's not how it is when it comes to aesthetics. Understand that aesthetics is not just about the teeth, it's about the whole face itself. So you have to make sure that the facial um, aesthetics is in balance with the occlusal or the dental aesthetics. So it is important that you figure out if the balance of the face is unique, is matching with the smile aesthetics. And there are lines that you need to draw and analyze if all the balance is there. And when you have to apply the golden proportion when you're setting up your dent or doing your anterior restorations. There are DSD softwares which kind of do this for you, wherein you just take pictures of patient in different angulations. You record the occlusal pictures, the lateral and everything, and then you mark all the points in the software, and the calculations are done by the software and they adjust it. So you can show the patient what is going to be the final outcome and what to expect at the end of your treatment. And if they want to do some adjustments, you can do it at that time before the final delivery is done. The the second important thing that you guys need to understand is occlusion, which is often overlooked. You need to understand where the occlusion is, and you need to make sure that it does not interfere with your restorations. If there are any interferences, you have to eliminate them in your during your final procedures. The next step comes shade selection. So understand the basics of shade selection is that it is hue, chroma, and value. So hue is nothing but the actual color of the tooth, like how we say red, green, yellow, and orange. You just say that is the actual hue of the actual color of the object is called as a hue. Chroma is nothing but a saturation of the color from the highest intensity of the color to the lowest intensity of the color. Next is value. It is nothing but the lightness or the darkness of an image. Is it too bright or it is too dark?
Because the human eye
This
more
is a description of how do you do shade selection.
The shade tabs are now B1, A1, B2, D2, A2, C1, C2, D4, A3, B3, B3, A3.5, B4, C3, A4, and C4. B1 has the highest value and lowest chroma. C4 has the lowest value and highest chroma. Ask the patient to remove any lipstick or distracting makeup to minimize the contrast effect. Step 3. Make sure teeth are clean. Perform a quick prophy if necessary. Step 4. Raise the chair so your eyes are at tooth level. 5. Stand 10 to 14 inches from tooth. Use indirect light for shade selection and turn off the unit's light. Using natural sunlight by shade selecting near a window is ideal. Step 7. Hand the shade guide in front of the patient's teeth in an edge-to-edge alignment with the natural teeth. Step 8. Squint your eyes for a more accurate value perception. Step 9. In this step, you will select the closest two shade tabs in value. Step 10. Don't stare. Make a decision in 5 seconds. Pick the closest two shade tabs from the guide and set them aside. Step 11. Rest your eyes by looking at a neutral color, like gray. This will make your eyes more sensitive to color again. Step 12. Make a decision between the two closest shade tabs you selected. Remember, don't stare and make a decision in 5 seconds. You have now selected the closest general shade of the tooth. If the tooth is polychromatic with different shades, record this on a shade map for proper communication to your lab technician. Step 13.5. Make sure to involve your patient in the shade selection process and document in the chart. This reduces unnecessary surprises at time of delivery.
So that's how you go about with the shade selection process. So here, if you see this image, you can see there's a complete shade mismatch, right? So how you select the shade is very important. So to understand this, know that the light passes through enamel and dentin to give you the color. So in the cervical area, because the dentin thickness is more, the hue of the tooth is darker in the cervical portion. In the middle third, there is an equal amount of dentin and enamel. So there is a little bit of an opaqueness or a lightness towards the central portion of the tooth. But when it comes to the incisal area, it's more or less like the light actually passes through the enamel. There's very less dentin in the incisal area. So what you have to understand that it will be having more of a translucency towards the incisal edge. Now, if you notice the tip of the tooth, there is a opaque margin that is called as the incisal halo. So this is like there's an opaque margin and the translucency created together gives it like a border kind of a thing. This whole thing together is called as an incisal halo. So you need to understand the depth of where the light is falling on the tooth to recreate the aesthetics. So you need to know at what thickness, what particular shade of composite you're going to layer from dentin to enamel to recreate the tooth structure. So this is how it is seen in our natural dentition. So you can see that the tooth is not monochromatic, it is polychromatic. You can see a variation of how the light is falling on the tooth and it is reflecting different levels of hue and chroma, and the value of the tooth can be appreciated. And you can see different textures on the tooth. So aesthetics is where you can replicate all of this. So how do you start with shade selection? Is using your shade tab, you have to rotate the tooth parallel to your actual tooth and area, and you select the shade as the cervical 1/3 for your dentin shade. So always allow the lip to fall a little over the shade guide, because your lip tends to cast a shadow over the tooth, and that will alter your shades. So you have to slightly select in both ways and then finalize the dentin shade from the cervical 1/3. Next, what you do is you turn the shade all around, and then you make the incisal edge parallel to the natural tooth incisal edge, and then select the enamel shade. This is how you select your dentin shade and your enamel shade. This becomes your polychromatic restoration shade selection. And another technique that you can do is called as a button technique, wherein you take small portions of composite and whatever you have selected, you place it as options on the tooth and tack cure them. And then whichever a shade is closely matching to the tooth, you keep that and knock off the others. This is one way of doing a direct shade selection. This is one of the ways to achieve a merged restoration or a camouflage restoration. So you just have to make sure that you select the correct shades and you blend it well so that you cannot make out the difference. Next thing that all of us face is a difficulty of demarcations. But demarcation is inevitable, and that is one of the reasons why we see a rainbow and the different colors in a rainbow. So now if you see this image, you can see that a demarcation line is clearly visible, but the shades are fine. But still you can identify that there is a restoration there. So how do we do eliminate this problem is by creating illusions. So in aesthetics, the way you can create illusions is by bevels. So you give different types of bevels so that you can blend the restoration. So all of us know that you give a bevel which has to extend 2 mm beyond the fracture line, and you can use a flame shaper to give the bevel. And but if you see in this image, you can clearly see a line. Now, if I remove the line also, you can make out there is a continuous linear line around the bevel. So if you can see the line, that means that line is going to show at the end of your restoration also. So you need to trick your eye, and you should be in a position where you cannot see the line anymore. So one of the methods to eliminate the line was giving a scallop bevel. So you kind of break the line by giving scallop margins around and kind of trick the eye that there is no straight line. So here, but the problem that happened is, in spite of giving a scallop bevel, you can still make out there is some kind of a bevel. So few authors suggested that you can give something called as a starburst bevel. So starburst bevel is nothing rather than that, like you give a bevel at varying depth and varying length. So this is how a starburst bevel is given. You give bevels in longitudinal section, but then you give it at varying depth and length and volume. So this is an image showing how a starburst bevel is given. I hope you guys can appreciate the starburst bevel within the margin. But here if you see, still there is a boundary that you can see, but it's not a linear line. But then you can see there is something. So to take it one step forward, what can be done is that you can polish it off. You make sure that you blend the bevels completely, that you cannot see anything there, and that is what is called as a infinity bevel. So you can see on the upper margins that the bevel is completely invisible, but in the lower margin is not polished well, so you can still appreciate a faint line. This is what is called as a infinity bevel, where you cannot actually see where the line begins or ends. That is, if you create margins, bevels which you cannot see, your restoration cannot reflect it. So you will form a very blended restoration in the end. Before you start with any procedure, two things are very important. One is isolation. You have to isolate the tooth when you're doing composite restoration. Any kind of moisture contamination during the procedure is gonna affect your final restoration drastically. But when you begin with etching, you have to make sure that you isolate the adjacent tooth and protect the adjacent tooth with Teflon tapes or any other means possible. So etching procedure involves using an etchant which you can control. So it's advisable to use a gel etchant, and it is like if you can write your name with a gel etchant on a tissue paper, that means you can control the flow of the etchant. Otherwise, the etchant is just going to flow off everywhere and you are not going to get sufficient concentration of the etchant. Now, there are different etching techniques which are there. So the total etch technique is wherein you completely etch the enamel and dentin together. Selective etch is wherein you etch only the enamel, and you self-etch is a procedure wherein you have a self-etch bonding agent with mild etchants within the bonding agent, which you're going to use to etch the dentin. These are the different etching techniques. Understand that the strongest bond which is formed is in enamel. So it is important that your preparations always end in enamel. As long as you confine them to enamel, your restorations are going to last a lifetime. The next step is the bonding procedure. When you're applying bonding agent and then you're curing it for 10 seconds, there are a few things that you should see. Always follow the manufacturer instructions or the instruction leaflet which is provided along with the bonding agent. Every company has a different bonding protocol depending on what is the composition of the bonding agent. So this will be mentioned in the instructions manual. Please read it and understand it, because different bonding agents will be, you might have to apply them by, you just add a drop and then you have to scrub them for 10 seconds. Some will suggest that you have to apply 2 coats. Some will suggest that you have to apply, leave it for some time and then cure. So you need to know what protocol you should follow only after reading the instruction manuals. The second problem that happens is you would have applied bonding agent, but then you will notice that there's an excess bonding agent and then you cannot place your matrix band in the proximal area. This is because your bonding agent excess has flown down into the proximal area, which has stopped, which you have cured and has caused an obstruction in your final restorative procedures. So once you apply a bonding agent, you have to gently air dry so the solvent evaporates, and then you can use a blotting paper or a dry paper applicator tip to kind of remove the excess bonding agent from the cavity. This way, you can ensure that there is no excess bonding agent in the margins and your restoration will not fall off. Now, if you come to this, here if you see, the bevel is completely masked. The shade is okay, but then still you can figure out that there is a difference in restoration. Now, this is because of using only one shade of composites. It's a monochromatic restoration. So, as I said earlier, your tooth is polychromatic. This is where you have to blend in with your tooth, your restoration to the tooth. So it's like if you can merge all your restoration and make your margin seamless to the tooth, like how the animals will camouflage themselves with the nature, wherein they are actually unidentifiable. It's very difficult to spot them until and unless you have kind of, zoomed in into them. So that is how your restoration should be. You should not be able to identify between a tooth and a composite restorations. And that is what makes a aesthetic restoration perfect. So you can achieve this by using a polychromatic layering technique. So to make it easy and simple, the one technique is to use a direct or an indirect markup. So what this is a cast where when indirect markup is being done after taking an impression of the tooth, and this is a direct markup. So either you make a direct or an indirect markup, then you make a putty index of the tooth that you of interest, and then you make a palatal shelf with the index in place, and then you start your build up. So this is a video showing how a direct buildup is being done. So here it was a fractured old composite restoration. So the fractured portion is being rebuilt with some expired composites or old composites, or a shade which you do not use. After you cure it, a silicone putty index is made, and then the excess, the old restoration is removed off from the tooth. A bevel is given. You can use a flame-shaped bevel, flame-shaped burr to give the bevel. After etching, a bonding agent is applied. This is one more way of protecting the adjacent tooth by just looping the mylar strip around the tooth. You have to make sure that you use a good intensity curing light when you're curing the tooth bonding agent. Otherwise, the bonding agents are not going to completely cure. After this, you can use a little bit of flowable composite on the margin, on the fracture line. Add the enamel shade on the palatal shelf area in the silicone putty index. Apply it on the palatal surface, and then make sure the restoration is blended to each other, and then cure it. Once it is cured, now you can see that there is a palatal shelf. You can cut small pieces of mylar strip and create the proximal walls by molding them to form the contour, or else you can use sectional matrices. So it's important that when you're doing a composite restoration, you blend from restoration to tooth, and then all excess are removed before you cure. Now, once the palatal shelf and the proximal walls are built up, you start your polychromatic layering. So you form the body of the restoration by using a dentin shade. You can create mamelons by using fine-tipped instruments to create the aesthetics, which is similar to the adjacent tooth. Make sure that all your restorations are cured well. This is a white opaque shade which is used to line the incisal edge to recreate the incisal halos. So apply these only if they are required or they are reflected in the adjacent tooth. Sometimes you might find brown spots or gray hue. You can recreate them by using stains. After this is cured, you're adding a layer of translucent shade towards the incisal 1/3 to recreate the incisal translucency. So when you're applying a composite, it's important that you push down and blend it upwards so that you remove all kinds of voids in the restoration. The translucent shade is again added up with one body shade, and then the restorations are merged, and finally enamel shade is added on. You can use composite brushes to create textures and make sure that the restorations are blended into each other. Once you finally cure, make sure that you remove all the excess. you can create textures on the restoration with the help of burrs, and then finally you can use polishers to polish the restoration. That is a buff which is being used, and that is how you create lifelike restorations. So you can appreciate the incisal translucency, the mamelons, and the textures which is finally created. So these are sectional matrices. As I said earlier, they can be used to create the proximal wall. Next thing is using bioclear matrices. They are pre-contoured matrices which adapt to the contour of the tooth.
Small drop of water
So
or astringent.
always it's better to add a drop of water before you place the matrix band into the subgingival area.
Lacquer matrices, because of their unique and patented root adaptation, become very stable without the use of a wedge. And in this case, there was no need to hold the matrices in place while rinsing off the etching. Notice how the matrix is easy to keep in position, even without a wedge. The matrix is easily teased away from the tooth to allow insertion of etchant and restorative materials. It opens and shuts like a trap door. Once a small hip of flowable composite is placed and cured, I will place a wedge to help create strong separation for the teeth for a tight contact. Once again, I tease the matrix back to finish placing the composites for this two-step staged wedging technique, which also utilizes the injection molding technique. I prefer to reach under the matrix to adapt the composite rather than pinching the matrix later during light curing. The major goal of developing the BioClear diastema closure matrix system was to reduce or eliminate interproximal finishing by creating ideal interproximal shapes. So I am here quickly finishing the facial area, which is much simpler than the old method for anterior composites, which required significant interproximal finishing. Now that we have the dedicated BioClear diastema closure matrices, treatment of difficult midline diastemas can become.
Next comes textures. So as I said earlier, you need to create textures on your restorations to make them lifelike. So how do you know how to give textures? One trick that you can do is you can take a carbon paper and rub it on the natural tooth so the textures can be seen. So you have to draw these textures on your restoration and then recreate them using burrs or polishers. So you need to know that you have to follow a sequence when you're using your polishing procedures. So first you remove the excess off with a BP blade or a scalpel. Use a fine burr to remove off the excess wherever required and give it a contouring, basic contouring. Then start with your polishing discs. Always do not jump from one disc to the other. You have to follow the sequence. So you go from coarse, medium, fine to superfine. Do not go from coarse to superfine in seconds. You will not finally get a glossy restorations. Following this, you can use FlexiPoint to enhance the textures and then finally use polishers to give it the shine. So this is one way of achieving predictable restorations. So understand that it is important that you go back to your basics. You learn what is composites, you understand what is the science behind the restoration, and then start applying it. But know this also that everything, whatever you know, might not be there another 5 years down the lane because the field of dentistry is so constantly evolving. Whatever concepts were spoken about 5 or 10 years back does not exist anymore. The concepts have completely changed. So it is important that you have to blend your knowledge, your vision to see how your treatment should be in the end, and your artistic skills to ultimately deliver to your patient satisfaction. So until and unless you have a sound knowledge of your basics and a good set of creative skills, you cannot perform well and have happy patients and happy bystanders. You should always know where are your limits, but always try to exceed them. Do not stop yourself. You have to push yourself because nobody else is going to do it for you, and your limitation becomes only your imagination. I would like to end my presentation by thanking everyone for listening, and I'm open for questions. Thank you.